I will leave the floor to our next speakers, Hansika Kapoor and Anirudh Tagat, who will be talking about the difference between individualistic and collectivistic cultures and how this impacts people's ways of coping with COVID-19. And the floor is yours.
Thank you so much.
Great. Thank you so much. My name's Hansika, and I'm here with my colleague Anirudh, and we're very happy to be able to participate in the Social Bridges conference, and kudos to Merla for reaching out and connecting with us. I think that the pandemic has obviously done much more harm than good, but one of the goods is the democratization and humanization of academia for my colleague and myself. We're researchers based in India. We work at a not-for-profit, and I'm at the Department of Psychology, and my colleague is at the Department of Economics. And what we've done is we've done a little bit of secondary data research on preventive health behaviors as they relate to worry in the midst of COVID-19. But what we've also tried to do is analyze this across various cultures. Next. So this is just a brief outline of our talk. It's the standard format of introduction, methodology, results, and discussion. But we do want to invite as many questions and comments on this work because it is a work in progress, and we would love to hear what you think about this. So as everyone knows, several governments around the world have introduced measures to control, contain the spread of COVID-19, ranging from severe, stringent lockdowns to other public health announcement measures and strategies for making sure that people engage in basic sanitation behaviors such as frequently washing their hands. So these measures have been varied across countries, and they have also evolved over a period of time depending on what stage at which the country is and the spread of COVID-19 is within that country. But some of the common measures across the board, across countries and across cultures, have been engaging in social and physical distancing. So that would entail maintaining a distance of at least 2 meters when you're out in public, wearing masks or face coverings when you're outdoors, coughing into your elbow, frequent hand washing, and of course, when you're feeling ill, staying at home and engaging in self-quarantine, and at the same time reporting of symptoms to the appropriate authorities. So there's been a mix of active avoidance behaviors, such as avoiding public gatherings and things like that, and active behaviors that you're supposed to inculcate and habits that you're supposed to build. The total confirmed COVID-19 cases per million is around, it's reaching the 15 million mark today. And the reason why I chuckled was not because I have a sinister sense of humor, but I was going through the paper that we had written, I think, about a month ago on the worry index and how it relates to COVID-19. And I had seen that in the introduction, I had just probably a month and a half ago, I had written that there were 8 million cases at the time of this writing. So yes, that has doubled. It is a grim statistic that needs to be updated over and over again. And it ranges, the cases per million range from less than 10 to over 15,000. And as you can see, the global spread is very varied. The darker colors represent higher rates of COVID-19 cases per million. And you can see that there are very clear geographical distinctions in where these cases are clustering. And one of the reasons why that happens is because of this variability in testing capacity across countries and cultures. So where does worry lie in all of this? As I said, official communication has asked us to avoid social gatherings, not meet our friends and family, particularly stay wary of elderly relatives because they would be the most susceptible, the immunocompromised, things like that. So maintaining and adopting new health behaviors, or for that matter, any new behavior sustainably, can be stressful. It can cause anxiety. But at the same time, this worry can also motivate future compliance with healthy behavior. So worry functions as this middle person, so to speak. So past behaviors can be affected by it, and worry in itself can affect future behaviors. And evolutionarily speaking, affective behaviors like worry facilitate adaptation by triggering approach and avoidance behavior. So we approach things that have positive consequences towards us, whereas we avoid behaviors that have negative consequences. Whereas what research has also found is that these motivations to approach and avoid do not occur in equal part. They are mediated, so to speak, by the cultural scenario that one finds oneself in. And at the same time, the level at which we perceive disease to be a threat also varies by culture. So there's a lot going on here in the context of worry and preventive health behaviors. So our research questions were exactly that. We wanted to know, in the first part of our research question, we wanted to know, do past health behaviors related to COVID-19, do they have an impact on the worry experienced by individuals in weird and non-weird countries differentially? Weird is an acronym. It stands for Western, educated, industrialized, rich, and democratic nations, as compared to non-weird cultures. You can consider the US to be the prototypical example of a weird country, and a country like India would be a non-weird culture. And the second research question that we also had was, does this worry then have an impact on the future behaviors associated with COVID-19, specifically down to the likelihood of leaving the house for getting groceries or getting medication or meeting your friends and things like that?
Thanks. So as my colleague Hansika mentioned, so we did sort of draw on a very large publicly available survey data set that the authors made available through Open Science Foundation and through sort of other portals. This is called the International Survey on Coronavirus, and it started sometime in around March, and essentially it has a whole team of researchers that were involved in drafting the questionnaire, and it has more importantly, it sort of has data on nearly like more than 100,000 respondents across several countries, and the idea is that this data was sort of meant to capture early sense of responses to the COVID-19 pandemic, as well as then the associated worries and a couple of other variables, which I'll be talking about. This data is free to use by other researchers, so I do encourage researchers who might be looking to do work on COVID-19 to look up this particular data set. So this was this data set was the survey was originally conducted by Timo Fetzer, John Haushofer, a couple of other people, and the dates for which we are kind of looking at this data set is between 20th March and 16th April 2020, not for any particular reason, but it's that the major chunk of responses to the survey come during this period of time. It's sort of later on that we get fewer responses per country, less consistent responses, etc. So what does the data set have? So it has sort of self-report questionnaires that deal with past and future behaviors. So the past behaviors, like Hansika was mentioning, are sort of those related to what practices you might have, avoiding social gatherings, hand washing at home frequently, things like that. And then it has sort of future behaviors, which asks how for in the next week or so, how likely are you to step out for the following activities? And it has like a whole set of different activities that it asks questions on. It could be like going out to buy medicine, going out to care for somebody else, or it could be going out because you want to express your personal freedom, or going out to exercise, things like this. So a whole range of things. It has a set of 5 questions on worries, which essentially deal with kind of questions like how worried about you, how worried are you about your health, how worried are you about the current situation, things like that. And alongside these, of course, it has sort of the usual social demographic characteristics of the respondents. So for this particular study that we're going to be talking about, we have data from 58 countries, where we had at least 200 respondents in the survey, and so totally we're looking at around 100 and a little bit more than 100,000 respondents, of which slightly more veering towards the females, and a slightly older population. Again, this is sort of worldwide worldwide characteristics. So we construct sort of a couple of measures that is worth talking about. So one thing is this idea of the worries index. So this is essentially a composite of 5 questions that the survey had. And as I mentioned before, these are essentially meant to proxy for kind of how worried you might generally be about, not just about COVID-19, but sort of about health in general. So it aggregates some of those behaviors, some of those worries. And the past COVID-19 related behaviors. So these are the specific behaviors that the authors sort of ask, so the survey sort of asked for. So we have sort of how likely are you to be staying at home, maintaining social distance, avoiding social gatherings, informing others if you had any symptoms related to coronavirus, and of course, frequent hand washing, which means more frequent than usual. And then it asks sort of questions on COVID-19 related behavior for the future. So like I said, how likely are you to step out for any of these particular activities? And the authors of the survey also are able to categorize some of these as sort of so-called typically good behaviors, in the sense going out, say, to purchase medicine or taking care of another person, or if you're an essential service worker, then going to a hospital, etc., versus sort of more of these bad behaviors, which they deem as slightly frivolous. It's obviously a little bit subjective, but they do say that things like going out for exercise and going out because you want to express your freedom, all of these things are slightly more tending towards the bad behaviors aspect of things. We do have an entire set of controls, so on which we don't really emphasize the results of, but these are things that we do control for in a regression, because the authors did sort of collect this data as well. So standard social demographic variables, and we also control for the number of COVID cases or sort of the infection rate on average on the day that the respondent took the survey. And the second thing that we do is also kind of looking at the stringency index. So there's a measure that was put together by the Oxford University team, and that essentially looks at the stringency of government measures. So these two are, again, control measures that we think would affect behaviors related to COVID-19 as well. We do this using a simple OLS method, and we use some country weights that are provided by FETSER. And for our distinction, we use this variable called the cultural distance to the United States, which is the distinction that Hansika was talking about earlier, the difference between, so we say weird and non-weird, but in a sense that what we're actually talking about is cultures that are cultural, or countries that are culturally distant to the US versus countries that are culturally closer to the US. There is a high degree of correlation between cultures that are distant from the US to being non-weird countries, but in essence it's not a one-to-one type of thing, but this is sort of a measure that is better able to tell apart those kind of cultural differences that we might expect. Okay. So in terms of the results that we found, so the first thing is that we're using an interaction model. So we're basically interacting the effects of, say, the past health behaviors, such as avoiding social gatherings, with the cultural distance variable, so that we're able to comment a little bit about what happens specifically in countries that might be, say, culturally distant from the US. So the first thing is that in the past health behaviors, such as hand washing and such as avoiding social gatherings and maintaining physical distance, actually predicted less worry. It was associated with less worry among respondents who are culturally distant from the US. And in general, we have this sort of reporting, and we have that in the result that went in the opposite direction, which is that if you reported symptoms in countries culturally distant from the US, you are kind of likely to experience a higher degree of worry, according to our index. And we have some sort of more general results that talk about how being culturally distant from the US was associated with a significantly lower value on the worries index in general. For our second research question, which is about worry explaining or being associated with leaving the house in the future, we found that more worry actually implied that individuals would leave their house, or rather were more likely to leave their house in cultures that were, or in countries that were culturally distant from the US. So, and this was more so than this was particularly pronounced for the so-called good behaviors. And in general, if you had a higher score on the worries index, you were going to you were less likely to basically leave the home in the next 5 to 7 days. Okay.
Sorry. So essentially what we found is that in countries that were culturally closer to the US, which is in weird cultures, there was an association of greater worry with, say, avoiding social gatherings, which is being interpreted as the reverse result of, as the inverse result of what we found. And that would probably be because personal freedoms matter very much in weird cultures, more likely to be liberal. In the earlier talk, we saw how individuals in the UK wanted to express their personal freedoms by either weaponizing coughing or not wearing a mask and things like that. So restricting movement, or even orders that are not necessarily lockdown orders, but shelter in place restrictions on one's movement in such cultures could be associated with more worry and more anxiety. The other aspect is that when we have to maintain 2 meters of physical distance when we're outdoors, it automatically requires applying very conscious control to something that seems to be a very automatic process. When you walk out or you step out of your home in outside your home, you do not have to think, or before the pandemic, you did not have to think about, am I sufficiently far away from another individual who's a stranger? But right now, that additional cognitive load has come into play. So different goals, for instance, urgency of meeting a certain goal affects the estimation of spatial distances in such an environment, and therefore it can have a subsequent impact on the anxiety experienced. This was not found in non-weird cultures, and one of the reasons why we think that may be is because non-weird cultures, or and let me take India as an example, do not have the luxury of large spaces. In most instances, such cultures or such countries are suffer from problems of overpopulation and overcrowding, as a result of which estimating social spatial distances may not even come into play at a cognitive level. What we also found is that narrating or telling symptoms to others in non-weird cultures was associated with greater worry. And this is actually consistent with previous research that has found that anticipatory worry is positively associated with protective health behaviors. And we do, of course, frame telling others symptoms of symptoms that you may be experiencing as a protective health behavior. Also in non-beard cultures, avoiding social gatherings, which means staying indoors, was associated with lower worry. And we theorize that that may have been the case because avoiding social gatherings in cultures such as mine could be associated with adhering or aligning with moral foundations of loyalty, of authority, of respect, which indicates a socially oriented moral stance. So the example would be that I am putting the group or the collective good, which is I'm not going outdoors and therefore infecting others or posing risk to others in above and beyond good for myself, which is I want to go out. So there is an element of collectivistic rationale that we have applied to explaining this result as well. But at the same time, individuals who did choose to go out as a function of their worry could have also been motivated by higher relational and communal concerns. So for instance, I would choose to go out of my house because I'm worried about, say, the health of my family, the health of my relatives, or I need to take care of this group activity and things like that. Now, again, this is completely a conjecture because this was not what the reasoning, except for just good versus bad reasons of going out. There was no other, that it wasn't explored at a more granular level, but individuals in non-beard cultures more often went out for good behaviors such as grocery shopping or buying medication or taking care of their relatives. Worry predicted that. Worry is also, of course, perceived differently as an approach or an avoidance motivator, as we discussed earlier across countries. And therefore, capitalizing on such differences in approach and avoidance motivations across cultures has been used by health communication strategists in the past. So for instance, in non-beard cultures, such as in India, when you highlight the potential losses from not adhering to certain kinds of rules and regulations. Say, for instance, if you do not wear a mask, you could contract the virus, you could transmit the virus to your loved ones. Collectivistic culture like India is motivated to avoid negative consequences, whereas an individualistic or a weird culture is more likely to respond to a health communication that highlights positive consequences of wearing a mask. Say, for instance, if you wear a mask, you will stay protected, you will protect your loved ones, things like that. So they approach positive consequences, or rather weird cultures approach positive consequences, whereas non-weird cultures are likely to avoid negative consequences. And therefore, this congruence between health messaging strategies and the culture in which they are being adopted can be extremely beneficial to promote adherence with policies on, say, social distancing.
Yeah, so I mean that's kind of what we found, or that's rather what we're finding from our study, because it's obviously still a work in progress. What we try to do is kind of highlight the behavioral antecedents and consequences of worry across cultures, and we're trying to kind of distinguish between a little bit between weird and non-weird, sort of westernized, educated, rich, industrialized cultures, and you know, there are obviously some limitations of the data set that we use. You know, I mean, unlike all the other fantastic speakers, I'm sure that we'll see today, who, you know, took a lot of effort to collect their data online. This does sort of rely on a survey that was collected by other researchers, but I mean, in a sense that it's also self-report, and that there is some lag in data collection. So it's likely that maybe there might be certain response biases, etc. But we're of course hoping that the sheer sort of the size of the data set and size of the sample that we have access to might help overcome some of those limitations. Okay. So these are our email addresses. That's us on Twitter. Yeah, feel free to contact us, and please do send us your questions and your comments. We would love to hear from you. Thank you so much.
Thank you.
Thank you very much, both of you, for this amazing talk. Again, if anybody has any comments or suggestions, questions, please put them on the live chat board. I wanted to ask you one question about this kind of link that you form between worry and it reducing the likelihood of bad sort of going out to just express your freedom. If I didn't miss it, or if I didn't get it wrong, you said that distance from the US was associated with lower worry, and increased worry was related to reduced likelihood of going out in a bad way. So from a public health sort of perspective, if the goal is to encourage, you know, distancing, hand washing, etc., measures that prevent the spread of the virus, given that US is doing notoriously bad, how do we explain this fact? Is it perhaps, I don't know, first thing on top of my head has to do with the country's lockdown measurements or the state's lockdown measurements? Perhaps, is that something you might consider controlling for in your analysis as well?
Yeah, we kind of did try to control for government measures related to COVID-19. So we introduced this thing called a stringency index, but the issue, I mean, of course, the issue with that is that it's an index, and it kind of aggregates many things that a government could be doing. So I mean, at that point is well taken. It could be very well that the government is kind of doing something that's very obviously worrying its citizens, and that's kind of either there's sort of this backlash effect where they're like, you tell us you can't tell us what to do, like we would like to step out, and yeah, it's very likely we haven't fully explored those mechanisms yet, but yeah, thanks for bringing that up.
Although I would like to caveat this entire thing by saying that please, I don't think the message should be to public health officials to induce worry in their citizens, to help them maintain, I mean, adhere to social distancing measures or whatever it is, but it is to understand what cultures they are operating within, to kind of align their strategies with what culturally we tend to be more receptive to as is.
Yeah, absolutely. It's a very important point that you're making. Policy decisions need to take into account the cultural makeup of that country. There's not one size fits all sort of policy recommendation that we can make. There's one suggestion. I don't know if you've heard of it. We have a whiteboard, and you can reach it from our website.
Yes.
And there's a suggestion for you to include the link to the data set on the whiteboard, please, in case anybody else wants to reach it.
Sure. Yes, we will.